Hi, I'm Dr. Autumn Morales, coming to you again from CRHC, and we're again doing our Pediatrician's Corner. Today we're going to talk about RSV. RSV actually stands for Respiratory Syncytial Virus, but I'm going to abbreviate that RSV because that's a lot easier to say. What RSV is a virus. It's much like other colds, but it's a little more aggressive, and rather than upper airways, it also infects the lower airways, which most colds don't, but others can. RSV is most dangerous in the very young and the very old. A lot of people don't realize that adults get RSV too, and it happens all the time. In fact, in RSV season, it's one of the most common causes of cold. And they have found that in adults that have actually died from flu, they suspect that it may have been a conjunction with a double infection with RSV and influenza. But back to our pediatrics, most dangerous for kids are little babies, as in less than 6 months old, less than a year, but less than 6 months is the most dangerous. Other kids that are at more danger from RSV infection are kids that have chronic lung disease, babies that were premature, children that have heart defects or other chronic issues, and children with Down syndrome. And there are some new studies coming out about genetic predisposition for more aggressive RSV infection. Unfortunately, those aren't really widely tested at this point, but in a few years we may be talking about something completely different as far as how to tell when it's going to be an aggressive disease versus just a cold. Most kids who get RSV do just fine. They get cough, cold, fever, and they get over it in a few days to a week or two with the mild cough. However, there are some kids that do get really sick with it, and what happens is it infects the lower airways. In little babies, this can be really hard because they don't really clear secretions very well, and one of the hallmarks of RSV is that it makes some really sticky, thick snot and sputum. You'll see these kids and they are just covered in thick snot, and they are constantly coughing. It sounds terrible, and generally it's really thick, sticky, stretchy, awful snot, for lack of better term. But what we'll see is these tiny babies just can't clear their airways, and suctioning sometimes just isn't enough, and you can really only suction the upper airways. But it's really impossible to get way deep in the lower airways unless a baby or a person is on a ventilator, which is another ballgame in and of itself. Most kids don't need admission to the hospital for RSV. Most children don't even come to the doctor for RSV because it is just a cold in most kids. However, those kids who do end up coming in, most don't need admission to the hospital. There's also some confusion among most parents that RSV needs nebulizer treatments, and that's really not true. It really depends on the child, and they've shown that if you give nebulizer treatments to children less than a year and questionably even 2 years with RSV, it can actually make the condition worse. Now, that being said, in children that are wheezing and children who have like asthma type picture, sometimes the breathing treatments help, but it's not a treatment for every child. Steroids are another thing that it's a big misconception. Some children steroids help, and in older kids and adults it actually has been shown to help, but younger kids it can be more harmful than good, and it doesn't really improve the benefit. That again, in asthmatic kids or kids with what we call reactive airways, it can be helpful. But the general kid with RSV, we don't necessarily do steroids or nebulizer treatments. It's really saline nose drops, suction, and supportive care, and watching the child's breathing. Another common myth that I hear a lot from parents is that if a child gets RSV, then they're going to have asthma. And that's really not true. RSV does not cause asthma. Now, they do find that in children that have a severe case of RSV that requires hospital admission, occasionally those children do have an increased predisposition for asthma, which what I'm saying is that it can be a risk factor that contributes to a child developing asthma. It's not really the cause, but it can be one of the factors. But a large study that was done not too long ago showed that kids that had severe RSV infection requiring hospitalization, who had asthma-like symptoms, they followed these kids out till they were like 13, 14. Most of the time the symptoms stopped by age 6, and the teenagers had no residual effects from having RSV. You can have some effects of wheezing and continued reactive airways with RSV, but it's not really asthma. It's kind of a chicken and an egg thing. What I often tell parents is it RSV that contributes to their asthma, or were they prone to asthma and that's why they had such a bad RSV infection in the first place? And most studies are pointing more toward the latter. So prevention of RSV, it's just like any other cold or flu type bug. It's spread through the air, so good hygiene as far as like cough, sneezing is very important for older kids and adults. Unfortunately, babies can't control where they sneeze and cough, so parents using good sense about where they're taking their children when they're sick. It's really try to keep them home. If you can keep them out of daycare at that time, if you can keep them from school, don't take them to the store or to Walmart where they're going to snot all over the carts and toys and all of that stuff. That's helpful for everyone. That being said, babies and young kids are going to put everything in their mouth and around their nose. Those things can be wiped off, especially if they're shared with other children. But in a household, it's really hard to prevent kids from sharing their germs. But in daycares, that is a really good preventative measure, is washing the toys frequently, washing the children's hands, and keeping their noses and mouths as clean as possible. There is a shot for RSV. However, it is used for babies that are premature, and it's actually very expensive, and the criteria are very strict. Generally, you have to have a prematurity less than 35 weeks of gestation, and the baby typically has to have had other problems, such as heart defects, lung disease, major infections, etc. Other kids that may qualify that were not premature are children with Down syndrome, children with a heart defect, or children with known lung disease. Sometimes we can get those children qualified. It's available for kids less than 2, and it's given from usually around late October, early November, all the way through April, because that's when we see the RSV season. It peaks in January, February, but we can see it in that entire span. Well, hopefully this was informative and you know a little more about RSV, and if there are questions, you can certainly post them on our Facebook page, and for appointments, you can give us a call at 712-542-8330. This is Autumn Morales, and you have a great day. Thanks.